present the research that was part of my PhD, that was co-funded by Blair, Avilez, and Nutrition Third World. Then I will also talk about the research outputs we got after this research. I will also talk about a related project that came out after this long-term cooperation that we have with UGEN. Actually, Ecuador has a long history of cooperation with Belgium, like centuries ago. And I will also talk about other impacts that came out after this long-time cooperation. So first, let me tell you about the project, briefly about the project that was part of my PhD and was co-funded. We ran a cluster randomized controlled trial to improve dietary intake and physical activity in adolescents in Cuenca, Ecuador. So it lasted 3 years. The name of the trial was ACTIVITAL. And the population were adolescents, school-going adolescents, 11 to 15 years old in Cuenca, Ecuador. The intervention, we developed a school-based intervention, a cluster randomized controlled trial, as I told you before. We had 10 intervention schools in which we implemented our intervention and 10 control schools. The outcome, we had primary outcomes, dietary intake, in which we focus on added sugar intake, processed food intake, snacking during breaks at schools, fruit and vegetable intake, and we also try to improve physical activity to increase the time children spend on physical activity and reduce sedentary behavior. And as secondary outcomes, we had BMI and waist circumference. So what were the objectives of this trial? On dietary intake, we wanted to decrease unhealthy snacking intake. We wanted to decrease sugary drinks intake. We wanted also to increase fruit and vegetable intake, increase healthy breakfast intake, and we tried schools to offer healthy options during break times. On physical activity, as I said before, we had two main outcomes at individual level, that adolescents spend more time on physical activity, on moderate to vigorous physical activity, and that they decrease their screen time. Also, we had some environmental issues in the intervention, so we did some changes in the school, and we also had some social events that I will show you. So, what was the progress of this trial? At baseline, we started with, as I said, 20 schools and 1,430 children that were randomized. 10 schools were randomized to receive the intervention, and 10 schools were randomized to be a control group. And we did 2 follow-ups. In these 2 follow-up times, every time we measured their dietary intake, their physical activity, and their anthropometry. So you see we had some losses of students after 3 years, mainly because they left the school or they changed the school and we couldn't follow them up. What were the strategies we use in our intervention? We have an individual component and an environmental component. For the individual component, we developed a curriculum in schools. So we developed a curriculum in a way that natural science teachers will deliver classes on dietary intake and physical activity to the children. We also involve parents. We organize workshops with parents to teach them also about healthy dietary intake and physical activity. And we also had workshops with the food kiosks or food talk shops staff to improve their knowledge about a healthy diet and trying in a way to have healthier choices at the school. We also developed posters. We have contacted famous sport people, young people in Ecuador. So we had posters in the school to show the benefits of being active or having a healthy diet. These young people also came to school and give talks to the children, telling them how having a healthy lifestyle helps them in their life. These are the pictures of the curriculum. So nutrition third world was very important for this part because the printing and designing of all this material was completely funded by nutrition third world. What happened after 3 years of implementation? We had some positive effects on dietary intake. So we managed reducing the intake of added sugar after 3 years. We also decreased the intake of processed food at school. And we actually didn't increase fruit and vegetable intake, but the decrease was attenuated because of the intervention in the intervention group compared with the control group. We also had an effect on physical activity. We measure physical fitness in these students, and the vertical jump was better in the intervention group compared with the control group. Also, the intervention group had a better result on speed after the end of the trial. And also, we had some effect in reducing screen time in the intervention group compared with the control group. We also had a positive effect, there is a mistake in anthropometry. In waist circumference, we have a reduction on waist circumference in the intervention group compared with the control group. And we also had a significant reduction in systolic and diastolic blood pressure in the intervention group. So now I will tell you the research outputs we had out of these projects. So we had, based on this research topic specifically, we had 8 research papers or in international peer-reviewed journals. We also published a book chapter. We published also a policy brief paper, and it was actually a way of starting a collaboration with the Ministry of Health, and we managed including one of the staff of the Ministry of Health in this paper. We also have had several presentations in international conference, and the ACTIVITAL, which was the name of our intervention, it's a brand that was registered in Ecuador and that we are still using for all the programs we implement and develop in Ecuador. We also had some related projects after this support and collaboration. We had some achievements. I included some logos, and one thing that's good in Ecuador is that the universities came an academic evaluation over 5 years ago. So it means that universities have to invest more on scientific outputs. So we have evaluations current every 4 or every 5 years, and a lot of grants are coming out because of this evaluation, and we have a lot of incentives to invest more on research and on publications. So we organized after this research, we organized a symposium ourselves in Cuenca, Ecuador, and we had a good acceptance of students and researchers in Ecuador. We also had a lot of Flemish students coming to Ecuador to support our research, but we also have a lot of students from Ecuador involved in our research doing their master thesis or bachelor thesis. And we have currently, during this whole time period, we have other kind of projects with different sources of financing. As you can see, most of them come from Ecuador. From the 11 spin-off projects we have, 3 come from international funders and 8 from national grants. I will tell you about some other impacts we have. So we have additional stakeholders and strategic alliances after this support we received. So when they presented me, you listened. I will be the secretary of the Latin America Society of Nutrition, so the president is Ecuadorian, and which means that in 2023, the Latin America Conference on Nutrition will be held in Cuenca, Ecuador, and the University of Cuenca will be the scientific coordinator of that meeting. Also, in Latin America, they are organizing the Latin America Society on Physical Activity, and I had the honor just this week to be invited to be part of it. They will organize it next year. And we also have now the BLIR Network Ecuador, which is a project funded also by BLIR, in which we have developed a master on bioscience, and we are in the second phase, organizing now a PhD on bioscience, because we don't have a PhD program yet in our university, but thanks to this collaboration, we are organizing the PhD degree on bioscience. And also my university support a lot of community support. I repeat the word, but let me explain you how it is. It's a community link-based project in which we should look for problems of the community, and they provide a small fund to support these communities. So as a continuation of the ACTIVITAL, I'm implementing part of the ACTIVITAL in some schools, thanks of this support that University of Cuenca gives to us. We also have had some dissemination activities, so we try to maintain a link with other researchers and with the community. So we organize some courses, some workshops, some talks. We also were involved in the developing of the results of the physical activity report of Ecuador. This is an international collaboration in which we followed an international protocol to develop grades on the state of physical activity of children and adolescents in Ecuador. We have also some policy-related research. As all of you said, it's always difficult to have these links with the policy makers. But we have involved with UNICEF Ecuador. We are working now in an evaluation of 2 ongoing policies in Ecuador. So we have a policy that regulates the functioning of school food shops. And also in Ecuador, some years ago, they increased the number of hours of physical education at schools to 5 hours per week. But this was never evaluated before, and now we are collaborating with UNICEF and with the Ministry of Health. We have been presented it to the Ministry of Health and to the Ministry of Education to support because they want to make changes of the policy, they want to evaluate it. So the idea is with these results, we will provide enough data to reformulate the policies, hopefully. And we also work with the local health department, I mean not with the National Ministry of Health, but with the Cuenca local health surveillance department, in a project in which we want to evaluate the national policy on fluoridated salt, because by law, our salt is fluoridated to prevent dental caries, but it seems that it has a bad impact already on the population. So we have local funds from the university to analyze the real impact of this policy. And we have been involved also in a project also funded by UNICEF, Latin America, in which we work together with Guatemala, Chile, and Ecuador to develop, to analyze the status of school environments in relation with dietary intake and physical activity. So we use photo voice techniques and qualitative research to analyze the status of the food and physical activity school environments. So I wanted to show that actually we are collaborating with several universities within Ecuador, and also outside Ecuador we have some research funds, as I told you, from Ecuador. One of here is Red Sedia that you see there. This is a local Ecuadorian organization that every year launches calls for research, for preparing symposiums, workshops, to bring experts to Ecuador and to improve the capacity building of our society.
Yes, Angelica, thank you for the presentation. My name is Diego Fallas. I'm from Costa Rica and I'm a master's student of nutrition and rural development. I have two specific questions. One, if Ecuador, or which are the basic regulations, laws, or programs that Ecuador has for the canteens, or if the Ministry of Education has, like, I don't know, regulation for the food that they are selling or they are given in the canteens or in the sodas, scholar sodas that we name it. And also, which, in that case, based on your study, which will be your policy recommendations for the country, basically national or regional level? And also, the second question is about the protocol that about the study of food environments on schools. I would like to know which protocol you use in this study for evaluate the food environment, and how do you catalog or characterize the food environment of the schools? Thank you.
I would like to ask you very specifically, from your perspective, now that you're in Ecuador, what are the main upcoming issues that are nutrition or food related in Latin America? And also, we know it is huge, Latin America, and there are quite some differences between the countries. Some are more developed than others. So what would be in your also you are now Secretary of the SLAN, what are the main upcoming issues in the agenda of nutrition for Latin America? Thank you.
We've been discussing about the importance of linking researchers and policymakers. And I see that in your career, in your work, I think you manage very effectively to link up with UNICEF and other organizations, and even the ministries of health. And so what would be your advices on this? Because from my experience, I see it's very difficult to be on the two sides, working with policymaking and advancing at the university. What would be your advice about this?
Thank you very much for your questions. About the regulations we currently have is in 2014, the Ministry of Health and the Ministry of Education got an agreement to regulate the food kiosks in Ecuador. This regulation is not really evidence-based, but what as probably you know, in Ecuador we have the red light system food labeling. So they forbid the sale of red labeled food items. They also open a contest every year. In such a way, they try to evaluate who is managing the school canteens. They didn't succeed too much so far is to evaluate the policy and to control the implementation. Because according to the current law, each school should organize their own committee, and the committee should include a director, a parent, a professor, and a student, and they are in charge of evaluating the policy. So that's the current status of the policy. So they want to reformulate it. So actually. That's why UNICEF is funding this project, and they have been talking with the Ministry of Education to reformulate it, and they want to evaluate and to show them what's working and what's not working with this policy. So that's basically what's going on in Ecuador. Regarding the food environment, the methodology we used. So in the project I had last year, we actually evaluated food environments and built environments. So for built environments, we use the MAPS methodology. We followed the IPEN methodology to evaluate the food and the built environment at schools. And for the UNICEF project in which I was involved, we use mainly qualitative research, as I said, photo voice, in which we selected a number of children, parents, and school staff and asked them some research questions. For example, what's the food that children bring from home? What's the food that they can buy at school? what's the physical activity they are doing at school, and we gave them an iPad and asked them to take pictures of their environment, and after that we developed focus groups. So we did the same in Chile, in Ecuador, and in Guatemala. In Mexico. It was Mexico, Chile, and Ecuador, but INCAP from Guatemala was leading the research. So we have already analyzed some data, and we found out that Chile and Ecuador, in countries in which we have food labeling, it was easier for children and for parents to understand, for example, the regulations. So that's what I can tell about this methodology. The main issues for nutrition and the challenges from Ecuador. Ecuador is now an upper middle income country with still a double burden of disease. We still have high rates of stunting, and overweight and obesity is increasing. We also, I think in the agenda, what's more important now and what's the view of the Latin America Society of Nutrition is to invest more on biodiversity, gender issues, and food systems. So that's what we plan for this new conference that will be held in Cuenca. And how did I manage with researchers and policymakers? I cannot tell you that what we do is perfect. I mean, I have some contacts, I have some people involved, but I don't really think that we already have succeed in changing policies. But something I did during my PhD is invite as a part of the committee evaluating my PhD, the person who led the national health survey in Ecuador. So that was a very good opportunity to show that person what we did, and that she is very well respected in Ecuador. It opened a gate for us to also have more contacts with the ministries of education and health, and through her, because she is almost retired, so through her, UNICEF is now working with us to do all these evaluations. So that's one thing we did. And another thing in the local Ministry of Health is I identify key people who has, as I told you, Ecuador has invested in the last years a lot on capacity building. So I identify people that have a good academic degree, so they can understand the importance of research on policy making. But still, although I identified those people, they have issues within the ministry convincing others that this is important. So that's what I can tell you.